If you're fully vaccinated, you have an extraordinarily small chance of being hospitalized or dying from COVID. We're talking about more than 99.999% of fully vaccinated Americans surviving thanks to the vaccine. Let's bring in our numbers whiz, Harry Enton. Harry, first, could you translate those odds for us? It is more than 99.999%. If you're vaccinated, those are your chances of surviving any breakthrough infection.
Yeah, I mean, look, we've had over 160 million Americans fully vaccinated. Of those, just north of 1,000 folks that died. It's so small. And, you know, what I'm interested in is comparing the fully vaccinated to those who are unvaccinated. And what we know is at this particular point, if you are unvaccinated, your chance of dying is 25 times higher than if you're vaccinated. So if you have the opportunity right now to go get a vaccine and you haven't gotten one yet, the numbers paint a clear picture. You should do so.
Right. I mean, that data, those numbers, that's so concrete there. What do you know about recent polling? What is it telling us in terms of who's most concerned about the Delta variant?
You know, it should be the unvaccinated, but the polling data suggests it's in fact the exact opposite of that. There was an Axios Ipsos poll that was done towards the end of last month, and what did it show? Extremely or very concerned about the Delta variant. Among vaccinated adults, it was 54%. Among unvaccinated adults, it was just 25%. And this might be part of the reason why these unvaccinated folks aren't getting vaccinated, is because they're not afraid of getting the coronavirus. But the numbers we show, they should be afraid. They should be afraid, and they should be going out and getting vaccinated.
Right. I mean, if you're unvaccinated with this Delta variant doing what it's doing, you are at very high risk of getting sick and contracting that virus. What about masking? Are we seeing a similar split there?
That's exactly right. You know, if you're not going to get vaccinated, then you should at least be wearing a mask, right? But what does the data show us? The data shows us that the unvaccinated folks never wearing a mask when leaving the home. 35% of unvaccinated adults are never wearing a mask when leaving the home. My goodness gracious, what are they doing? That is significantly higher than the percentage of vaccinated adults who are never wearing a mask when leaving the home. So to me, this is all nutter butter. It makes no sense. These unvaccinated people, first off, they should get vaccinated. And if they're not going to get vaccinated, they should at least be wearing a mask. And 1/3 of them say they're never wearing a mask when leaving the house. It's mind-boggling. It's crazy. I don't get it, but the numbers are the numbers.
All right. Well, thanks for walking us through them. They're very persuasive. Harry Enton, thanks so much.
Thank you.
And joining me now to discuss is Dr. Anand Swaminathan, an emergency medicine physician in New Jersey. Dr. Swaminathan, great to see you. 99.999% of people who experience a breakthrough case do not die. How do you feel about those odds?
I feel pretty good about it as someone who is vaccinated and who lives in a state where vaccine rates are really high. That makes me feel good, not just for myself, but for my community, for my kids who are going to be going back to school, and for the patients that I take care of. And I think that's reflected in what I'm seeing at work. What we're seeing is that there are people who have COVID symptoms, but very few of them are very sick. And a lot of that is because of how well we've done with vaccination in our state and in the states around us. But, you know, one of the things that comes up over and over again that we have to really be careful about is that, yes, the vaccine, highly protective for me, highly protective for those who are vaccinated, but it's not just a personal choice to get vaccinated or not. Because of how it affects everybody else around you, we're going to see spikes with kids. We're going to see going back to school that schools are going to get closed down again because there are going to be outbreaks. And this is the thing that maybe people aren't really as focused on as they should be. It's not just about protecting yourself. It's about protecting everyone around you, including those who can't be vaccinated or have immune compromise, and the vaccine doesn't work as well for them.
Right. And so many of the people who can't be vaccinated are 12 and under. These are our children, right? I mean, those are the kids and the people that are some of the most at risk because they can't be vaccinated. Experts are warning that cases and deaths will continue to increase over the coming months in light of the fact that about half the country remains unvaccinated. Here's what Dr. Fauci said about it this morning. We'll listen.
I don't think we're going to see lockdowns. I think we have enough of the percentage of people in the country, not enough to crush the outbreak, but I believe enough to not allow us to get into the situation we were in last winter. But things are going to get worse.
Dr. Swaminathan, how worried are you about where this is headed, what the trend lines look like?
I think as a country, we're not going to see the same spike that we saw in the winter, or if we go back to March, the same spike that we had in our area. The problem is that regionally, we're going to see huge spikes. And talking to my colleagues in other states, they're already feeling it. Their emergency departments are full, the hospitals are full, there are no ICU beds. I've spoken with a couple of folks who deal with transferring patients when there are no ICU beds, and they're like, there's no ICU beds in my county, there's almost none in the state, and that's not just for adults. There's no pediatric ICU beds either. So that means that if a kid gets really sick, there's nowhere to go. And it's not just about COVID. If you get in a car accident and you're really sick, there's no place to go. And so those states, Arkansas, Louisiana, Texas, Florida, they're going to see huge spikes in cases. They're going to see a lack of ICU beds, and they're going to see spiking deaths because of the lack of resources. It really is a very complicated layout when you have so many cases coming up. It's not just about how lethal COVID is. It's about how lethal it is in the setting of reduced resources, which is what we're going to be seeing.
Right, the strain on the healthcare system generally. South Carolina's Republican Governor Henry McMaster is accusing U.S. health experts of, quote, exaggeration and engaging in frightful hyperbole in regards to the tone being taken to explain how serious the Delta variant is, how different it is. We should note Governor McMaster is encouraging people to get vaccinated. Do you think is anything being blown out of proportion?
I'm very offended by the comment as a doctor and for my colleagues who are doing this work as well. And this is why we don't take our medical advice and our scientific advice from politicians. That's not how this works. I think it's great that he's pushing for vaccines, but how confusing of a message is that to his constituents? Get vaccinated, but it's not as bad as everyone's telling you it is. And this disinformation is killing people. Absolutely, it has been the whole way through. And it's getting worse because it's hard for people to really tease apart the information that's coming at them and know what to do with it. This Delta variant is terrible. It's spreading faster. There are hints that it could be more lethal. And even if, again, the virus itself isn't more lethal in this variant, with our waning resources because of how many cases we have, it will end up being more lethal. And look what we see in India, what we saw in the United Kingdom. This is not a good thing. And listening to a politician talk about science, it's absolutely embarrassing for him to be really putting these ideas out there that are, frankly, just they're lies.
And, you know, there is so much that changes, and I know people are tired of having to follow every tiny change, but this Delta variant is different, and as you just explained, why it's so different, why it's so serious. Dr. Francis Collins, the director of the National Institute of Health, expressed support for having businesses require vaccine credentials if that helps encourage people to get vaccinated. You've said you think it's time for the U.S. to start moving toward vaccine mandates. Have we gotten to the point where that's the only tool left in the box? Are there other things that can be done?
I'm sure there are other tools that we can look to as well, but I think the time for vaccine mandates, for vaccine passports is here. If not, it's already passed. We should have started this a while ago. I think we absolutely do need to see this. And I think it's great that individual businesses, private businesses are requiring their employees to do this or to get tested very frequently. My hospital just recently said that they're going to require everybody who works there to be vaccinated. I think that is a huge positive step. But I think we need something that is a little bit more across the board to really require this. And, you know, the time for the carrots, the rewards for getting vaccinated, it's still there. Anything that we can do to get people vaccinated, to convince them to do so is great, but it's time for us to also add some of the other ways that we can encourage people by taking things away. If you're not vaccinated, you can't do X, Y, and Z. Yes, you've made a personal decision, but you're also making a personal decision to put others at risk, others at harm, and this is how you're going to be penalized. Now, we might even see insurance companies saying that if you're choosing not to be vaccinated, you're going to pay a higher premium, similar to what they see for people who smoke. And that's going to be another stick to try to encourage people that this is the right thing to do. Get vaccinated. And I can't really say it enough times. If you're out there and you have access, if you can get vaccinated, go get it done today.